I have some very important information to share with you regards the certifying deaths due to COVID-19. There are two documents which are very similar. I'll read out both for you. This is from the Australian Bureau of Statistics. The document was added or updated on the 25th of March. That is just about the time, or 2 weeks after, the so-called scamdemic was declared, but even though it wasn't declared, it was only characterized, had characteristics of a pandemic, scandemic, whatever, never, ever, ever declared. But anyway, very important, I'm going to read here. This guide, published by the Australian Bureau of Statistics, is intended to provide some immediate guidance on how the new coronavirus disease strain, i.e. COVID-19, should be recorded on the medical certificate of cause of death. Examples are included in section 5 of this document. 1. Recording COVID-19 on the death certificate. The new coronavirus strain, COVID-19, should be recorded on the medical cause of death certificate for all, you notice all in capitals, decedents, the word decedents, where the disease caused or is assumed to have caused or contributed to death. Get that? Where the disease caused or is assumed to have caused or contributed to death. Terminology. The use of World Health Organization terminology, COVID-19 or coronavirus disease 2019, should be certified on the death certificate. Terminology such as SARS-CoV-2 can be used, but it must be clear that it is the 2019 strain of disease. WHO terminology is preferred. 2019, even though this only happened in 2020, but anyway. The term coronavirus should not be used in place of COVID-19 or coronavirus disease 2019. This will introduce uncertainty for coding cause of death, which may lead to underreporting in national statistics. Chain of events. Due to the public health importance of COVID-19, the immediate recommendation is to record COVID-19 in Part 1 of the medical certificate of cause of death. And as you'll see here, there's two parts. There's a Part 1 and Part 2. But they do want it in Part 1, the most important part. Specification of the causal pathway leading to death in Part 1 of the certificate is important, and all conditions and symptoms should be included. For example, in cases when COVID-19 causes pneumonia and fatal respiratory distress, both pneumonia and respiratory distress should be included along with COVID-19 in Part 1, alongside the duration of each disease and symptom. Certifiers should include as much detail as possible based on their knowledge of the case, medical records, laboratory testing, etc. Comorbiditis. Existing conditions, especially those which are chronic in nature, that may have also contributed to death should be certified in Part 2 in the medical certificate of cause of death. So I'll repeat that. Existing conditions, especially those which are chronic in nature, that may have also contributed to death should be certified in Part 2. So what they're saying is these things that have actually killed the person are only in Part 2. Chronic conditions may include, but are not limited to, coronary artery disease, COPD, diabetes, cancer, or diabetes. If you don't know what COPD is, that is chronic obstructive pulmonary disease. It's a type of obstructive lung disease characterized by long-term breathing problems and poor airflow. The main symptoms include shortness of breath and cough. COPD is a progressive disease, meaning it typically worsens over time. So, but that's only in Part 2. So here we go. Example medical certificate of cause of death cases. Example of train of events in Part 1 of medical certificate of cause of death. We have cause of death, acute respiratory distress, pneumonia, COVID-19, all in Part 1. Then we have example of chronic conditions in Part 2 of medical certificate of cause of death. We have the same ones here, but in Part 2 we have coronary artery disease, type 2 diabetes, COPD. COPD, it's pretty deadly, but, it's only in Part 2. Part number 3. Example of other specified immunocompromised conditions in Part 2 of medical certificate of cause of death. We've got the same thing. And Part 2, diffuse large B-cell lymphoma immunosuppressant therapy. It goes on one more. Example of disability in Part 2. Same thing here. Then we got cerebral palsy. But you notice COVID-19 is always there in Part 1. Coping of deaths due to COVID-19. The Australian Bureau of Statistics assigned codes from the International Classification of Disease 10th revision to all conditions listed on the medical certificate of cause of death. In response to the COVID-19 pandemic, the WHO has issued emergency code, blah, 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 blah. I'll tell you, this is 2 weeks after it was supposedly declared a pandemic, mind you, to be assigned to all mentions of COVID-19 on the death certificate. Due to the public health importance of COVID-19, the WHO have directed that the new coronavirus strain be recorded as the underlying cause of death, i.e., the disease or condition that initiated the train or morbid events, when it is recorded as having caused or contributed to death. Following the guidelines above will assist in the accurate coding of these deaths and the production of robust. So basically, they're virtually saying you've got to put COVID-19 in Part 1 well before all these other chronic conditions, including COPD, cancer, disabilities. So I'll just read the other site, which is pretty similar. This is COVID-19 Guide for Medical Practitioners. This notice is provided as a guide for medical practitioners completing death certificates in COVID-19 related deaths. This notice is not intended as legal advice. If someone dies from diagnosed COVID-19 or probable COVID-19, is that a reportable death under the Coroner's Act? No. Please see the notification on the court's website. A death due to or probably due to COVID-19 or its complications is a natural cause death and is not a reportable death under Coroner's Act. A death certificate can be completed in the similar manner as a death due to influenza or other viral infection. What is recorded on the medical cause of death certificate? The ABS has provided guidance on how to certify deaths due to COVID-19. COVID-19 should be recorded on the medical cause of death certificate for all deceased where the disease caused or is assumed to have caused or contributed to death. I think we said that before. When can COVID-19 be assumed to have caused a death? Where a person has been tested and confirmed to have COVID-19 and has died of complications associated with the infection, such as myocarditis or pneumonia, then COVID-19 is assumed to have contributed to the death and should be recorded on the death certificate. So it's only an assumption, but that's good enough to put on a death certificate. Where a person is known to have suffered typical symptoms that are common in the flu and the common cold, all the common symptoms, runny nose, fever, headache, whatever, such as fevers, cough, there we go, or breathing difficulties during a COVID-19 pandemic, but has not been formally tested or diagnosed. Now, there's no need to test or diagnose. Then it is reasonable to assume that death was related to COVID-19 and should be recorded on the death certificate. I'll read that again because this is the most important paragraph of all. Where a person is known to have suffered typical symptoms of COVID-19, such as fevers, cough, or breathing difficulties, same symptoms as what we've had for years and years, seasonal flu. They stipulate, of course, during a COVID-19 pandemic, When's the stop and start of this pandemic? I suppose it's start. Is it ever going to stop? But has not been formally tested or diagnosed, then it is reasonable to assume the death was related to COVID-19. It should be recorded on the death certificate. It's just an assumption. So if you've got a runny nose or a cough, and you die from, all these other things, you will be on the death certificate and recorded as a death statistic. Certification of deaths occurring at home will depend on the information available to the certifying medical practitioner. Where there is no recent history of respiratory symptoms, fever or other symptoms known to be associated with COVID-19, and there are no other underlying conditions that could explain the death will need to be reported to the coroner. In summary, medical practitioners should write COVID-19 confirmed or suspected. Once again, in summary, medical practitioners should write COVID-19 confirmed or suspected on the death certificate when they determine, to the best of their knowledge and belief, that the patient was suffering from the infection and this was a likely causative factor in their death. A likely causative factor, an assumption, just to put the, COVID-19 on the medical certificate part 1. It's an assumption, and that's what all this shit is. It is all an assumption, and not only that, it is all fucking bullshit.